My name is Virgil Brown. I'm a physician working at White Wilson Medical Center. I've been here since 1998. I am an internal medicine physician and do primarily outpatient care. I am the medical director here as well, and I've been the medical director here for about 5 years now. White Wilson's been working with CareTrack since 2017. So one of the challenges we have is we have lots of patients with chronic medical ailments, and we have limited ability to stay in contact with them and to manage those medical ailments, especially between physician visits. So Medicare came up with this program called the Chronic Care Management Program, where they provide resources so that we can stay closer in connection with our patients. We have a need for ongoing communication with our patients in between physician visits. So for example, people with heart disease or people that smoke, we would like to have a better way to communicate with them in between doctor's visits, and another way to remind them to keep up with their healthy behaviors and to keep on top of their medications and all their interventions that we recommend at the doctor's visits. So CareTrack has done a wonderful job in communicating with the patients for us in between those physician visits. They can contact them every week or every month or even quarterly if the need arises. I was initially skeptical way back there in 2017 because it's not my nurses, it's not my team directly communicating with them. So as physicians, we're always worried about having anybody else involved with the care of our patients that we don't know and don't have a established trust with. So initially, I was cynical and skeptical. So there's a lot of ways that we work together. We communicate daily. I get communications with CareTrack people through the electronic medical record, primarily, occasionally through emails as well. But we send messages back and forth to one another on given patient charts and whatnot. CareTrack also reviews the notes for our patients at the times of our visits. So I'll create a note, I'll see a patient and generate my progress note. And then CareTrack will contact those patients a couple weeks or a month later, and they'll review my note and point out that, oh, Dr. Brown wants his patient to quit smoking. Let me make sure I remind the patient to quit smoking when I speak to them today. Or let me remind them to exercise, or let me see how they're doing with remembering to take their medicines. So we have a very frequent communication with CareTrack. It's at least daily in one respect or another. So CareTrack has access, they have open access to our current medical record. And this is what makes it such a seamless communication with us. I'm sitting here in Fort Walton Beach typing my notes, and I'll send a message to CareTrack through the electronic medical record, and they'll get that message, less than 60 seconds later, and then they can respond in turn. They review patients' charts, they review the patient's visit notes, so it's a seamless communication through the EHR with CareTrack. So medicine, as we all know, has become more and more complicated. There's more expectations placed upon physicians from Medicare. There's more expectations keeping track of the medical science. Patients are becoming more and more complicated. So as this level of complexity and difficulty and work burden has increased on physicians, CareTrack has been there with us to help offload that work. CareTrack has been able to help facilitate better communication with patients. It's been able to facilitate communication from patients to us, and it's been able to help keep track of the complexity of the testing that patients wind up needing to get done, to keep track of the multitude of medicines that they're on. So they've really helped to make our lives much easier than they would otherwise be if medicine and those trends continued upward. So as we all know, medicine has become more and more complicated over time. The science of medicine is more difficult. The bureaucracy of medicine is much more difficult. Patients live longer. Patients have more ailments. And through the continuous communication that CareTrack has with our patients and with us, they've been able to offload a lot of that difficulty. They're able to facilitate better communication with patients and able to keep patients on track for all of the medical complications and challenges that they face on a daily basis. So it's really been interesting. Initially, my patients have also met CareTrack with skepticism. We all are aware of the frequent phone calls that we get of people trying to sell you things from phone numbers you don't recognize. So patients receive those CareTrack phone calls with that same level of skepticism and distrust. But over time, patients have really grown thankful for this communication as a general rule. Some patients are still irritated with regular phone call and regular communications. But the majority of my patients are very happy with this additional service that's provided to them that Medicare covers. As a physician, my number one priority is trying to take care of my patients and provide the best care that I possibly can. It gives them better communication with me and better ability to keep up with all of their medical needs. One of the most recent services that they provide is this remote patient monitoring, where they provide patients with blood pressure cuffs, glucometers, pulse oximeters, ways that patients can monitor their own health and then keep me informed of the results on a day-to-day basis. Some of the results that we've noticed in working with CareTrack have been generally patients are very satisfied with being able to reach out to us and have better communications with us. We've had patients come in and remark specifically about the relationships they've developed with the CareTrack nurses. So we've had significant spikes in patient satisfaction. And then we've seen decreased utilization of emergency rooms and hospitalizations because of this. And subjectively, I can attest to that in my own practice. So I've got healthier patients and I've got happier patients as a result of it. CareTrack specifically helps our patients' health in several ways. In terms of behavioral modification, you can see that the patients where they allow CareTrack to participate in these phone calls, those patients tend to be more engaged in their own health care. They tend to be more willing to pursue behavioral health modifications, quitting smoking, losing weight, exercising. We also see better medication compliance because these patients are able to reach out to us through CareTrack if need be, whenever they're running out of medicines. We've seen more compliance with doctor's visits because the patients know how to reach us. They can reach through CareTrack and set up their appointments when things are falling between the cracks. There have been several ways that CareTrack has helped our patients out. The patients that are most benefited by these kinds of programs are the more complicated patients. They tend to be older patients. They tend to be patients that are not technologically savvy, so they aren't able to use all of the computer resources available to communicate with us. They tend to be the patients who are on multiple medications and need constant surveillance and monitoring. And they tend to be patients with unstable medical ailments. One of the benefits that CareTrack provides is increasing physician revenue. The service provided by CareTrack, specifically contacting the patients on a monthly basis, it's a reimbursable service. And the physicians collect for that service. So naturally, it has been a big game changer for physicians overall here. It's really helped us to supplement physicians' revenues and to improve physician recruitment, because now we're able to pay them a little bit better salaries because of this collaboration and these reimbursements that CareTrack helps us obtain. So the most complicated people that we have tend to be Medicare patients. As you can imagine, Medicare patients are older, they have more complicated illnesses, they have much more complicated medication regimens, and so those are the folks that benefit the most from these CareTrack services. And these are the patients that were most able to see a dramatic reduction in emergency room visits and hospitalizations because of the assistance that CareTrack provides for them. So our practice has a great partnership with CareTrack, and we started working with CareTrack in 2017, and it's been a steady learning curve as we've figured out exactly the ways that they can help us in various avenues and the specific needs that we have. So every day we're learning more and more about the needs that we have, and we communicate on a regular basis with CareTrack to learn how they can fill those needs. Initially, it was something simple. They were, I think initially when they started working with us, we were having them do phone calls to our patients in preparation for the annual wellness visits. As we got into the chronic care management program, they stepped up and participated by making those regular monthly outreach phone calls to our patients. More recently, we have utilized CareTrack to do home remote patient monitoring services. And this is where patients have different tools at the house that are connected electronically, both to CareTrack and then ultimately to our medical practice, so that we can see how patients are doing in terms of blood pressure, or in terms of their glucose readings, in terms of their oxygen readings, or in terms of their daily weights at home. So it's an ongoing, evolving, and steadily improving relationship that has been very effective, and we're very thankful for it. Yeah, I'm very pleased to recommend CareTrack to other practices. I think that if a practice doesn't step up and partner with CareTrack, they certainly need to partner with somebody who can provide these services. I'm not aware of companies that do everything that CareTrack has done, and like I've said previously, CareTrack provides annual wellness visit questionnaires. CareTrack provides the chronic care management program. They provide remote patient monitoring. They've been incredibly effective and reliable at answering phone calls from patients that are enrolled in these programs. I even I periodically do a test run where I myself call that phone number. And every time I've done it, a CareTrack person, a nurse, has picked up the phone and answered, so that when these patients call, they get a live human being, which is just, can't be overstated in this day and age and for this sector of the patient population. As I think about the main thing that CareTrack provides for physicians, we, as physicians, the number one thing we want to achieve is quality care for our patients. That's the one thing we went into medicine for, and that's the one thing that helps us sleep better at night, is taking good care of our patients. And that's what CareTrack provides. CareTrack gives our patients better quality care. There's just no question about it. CareTrack helps with the revenue for physicians. That's something that's important to all of us in this more and more challenging time of healthcare. CareTrack helps offset and reduce expenses to Medicare, and that's been shown to be the case in big research studies. But the number one thing that it does is it provides quality care to our patients. And that's what I'm most thankful for in this relationship with CareTrack.